So now has come my time to shine. We're going to talk about migraines. So there are multiple risk factors for migraines, mainly genetics. Genetics have a huge role to play when it comes to migraines. Age also has a lot to do with when you'll start getting migraines. Most migraine sufferers start getting migraines either right before or during puberty. Gender, if you are a woman, you are almost or more than twice as likely to get migraines than a man would be. And then certain hormones, if you have hormone imbalances, you're more likely to get migraines. So migraines are recurrent attacks of typically throbbing and often unilateral, meaning on one side of your head, often severe headache with certain associated features such as nausea, phonophobia, and or photophobia. And if you don't know what phonophobia and photophobia are, that's sensitivity to light or sound. Though not everyone is sensitive to light or sound, so if you have a friend who has a migraine and they're not in a dark room, don't tell them, oh, shouldn't you just be in a dark, quiet room? We know what works for us. And migraine affects 8% of all men and 17% of all women in Europe. So migraine symptoms can be broken down into 4 distinct stages: pre-attack, aura, attack, and prodrome, meaning post-attack. So pre-attack symptoms, these are like the week or a couple days leading up to a migraine attack. So you might deal with constipation, mood changes from depression to euphoria, food cravings. These are the strongest food cravings in the world. When I'm about to get a migraine, I cannot stop craving Spice Station for the life of me. Neck stiffness, increased thirst and urination, and frequent yawning are also pretty common pre-attack symptoms. Aura symptoms. This is like the 1 to 2 hours before you have an actual migraine. So this would be seeing stuff in your field of vision. Visual phenomena are the most commonly associated things with auras. For me, I've had auras where I see like blobs of color floating in my field of vision. I've had like text lift off the page of a book and like rotate and float around in my field of vision. And then I've had lights strobe when they weren't actually strobing. Some people lose their vision when they have an aura. Pins and needles sensation in an arm or a leg, that's pretty common too. Weakness or numbness in the face or one side of the body. This is called hemiplegic migraine, and that's a type of migraine that actually mirrors the symptoms of a stroke, including the difficulty speaking. That's called aphasia, and I get it to a much lesser degree where it's more like I have trouble finding my words, to the point where one time I just completely forgot a number existed. For some reason, I needed to do 10 minus 6 in my head, and in my head I kept thinking the answer's 3, no, it's 5, and I just forgot. It took me a good 2 minutes to remember that there was a number between that. You might hear noises or music that aren't really there. That was definitely an aura symptom for me for a good few years. And because my brain hates me, the music I would hear was slow, creepy clown music coming from my closet. Not only would some people don't like just hear stuff, phantom smell is also a thing that happens for a lot of people. I was dealing with that a lot when I was in the 8th grade. I would smell like rotting garbage or burning charro beans when nothing was there, like just constantly. That's all I could smell. And then some people have uncontrollable jerking or other movements. So now we're going to talk about the attack. So this is what most people would probably associate with a migraine. So this is pain usually on one side of your head, but often on both sides. It throbs or pulses It can cause sensitivity to light, sound, smell, and touch. For the pain, if you know what an ice pick is, just imagine that stabbing into your head over and over and over again. Nausea and vomiting. Migraines are the only thing that in the world that can make you think of vomiting as a plus, because for some reason, right after you vomit, the pain just goes away for a good 30 minutes, and you just feel amazing. And then lightheadedness is also common for a lot of migraine sufferers. For me, I get vestibular migraines, so I would just constantly feel like someone was pulling me to the ground. Even if I was sitting with my back up against the back of a chair, I would just feel like I was about to fall constantly. So, because of the episodic nature of migraines, there are certain things that trigger attacks. Hormonal changes in women, certain drinks, caffeine, and alcohol are known triggers for a lot of people. Sensory stimuli. So, if I'm in a movie where there's flashing lights, that triggered a migraine once. I went to homecoming one time and the DJ had strobe lights. That I could feel myself getting a migraine, so I had to leave. Sleep changes. You get too much sleep, you get a migraine. You don't get enough sleep, you get a migraine. Physical factors. If you know the adrenaline rush you get on a roller coaster, for me, that is just a migraine waiting to happen, because that rush of adrenaline is a trigger for most migraine sufferers. Weather changes. If a cold front comes through, that means the pressure in the air is shifting, and every time that shift happens, I get a migraine. Medications. So if you have a migraine, you decide to take medications for it 4 times in a week. Well, sometimes that 4th time, that could give you another migraine that comes back, and it's worse because you've taken that medication too many times. Those are called rebound migraines, and if you're a chronic sufferer, you have to be really careful and watch how many times you've taken your meds in a week. Certain foods and food additives are known triggers for a lot of people. MSG, I know, is a big one in the migraine community as a trigger. And for treatment of migraines, it's broken up into 2 pretty distinct categories. Relief medications, so these are the medications you would take when you're having an aura to hopefully stop the migraine before it happens. And then preventative medications, which is what you would take on a day-to-day basis to try to lessen the frequency of attack. So for relief medications, you have your over-the-counter or prescription pain relievers, so think Advil, Aleve, stuff like that. You have triptans, which are prescription medication. They block pain pathways in your brain, and anti-nausea medications and Benadryl. If you take them with your migraine relief medications, they've been shown to help you absorb your medications better. There are also newer types of relief medications that you may have seen ads for, like Ubrelvy. Those are a new type of medications for relief and preventatives, actually, called CGRPs. If you've seen ads for Ajovy or Emgality, those are all CGRPs. So for preventative medications, you have blood pressure lowering medications, antidepressants, and anti-seizure medications, as well as those newer CGRP medications and Botox. The reason I don't have those on here is because you cannot get those until you are over 18, and even then, a lot of the time, it's hard to get insurance to agree to it. And now what I would like for you to do is to go and watch the other video about my journey. It just kind of explains my journey coming to terms with my migraines and all the stuff I had to go through to get to where I am now. And after that, you only have 2 more videos. So thank you.